And the other thing I'm thinking of, and you tell me if this is faulty thinking or whatever, but you got some kind of strange, insidious onset of a localized symptom. Are you thinking ever that there might be something sinister here, that might be non-mechanical?
Oh, absolutely.
Yeah.
Absolutely. And that was actually kind of a big discussion that we had afterwards. I mean, I haven't told you about the physical exam, but, and I don't know if this is like, I don't want to steal the punch of this, but at the end of the day one of the big potential classifications on our in our minds, and we couldn't deny it, is, could this be a fracture? Could it be like a freak fracture? Now, and this person, is only 29. She seems to be in good health. Why would she have, such brittle bones? They're very hard to explain. But there are always exceptions to the rule.
Yeah.
Right. And that's part of the diploma program, is learning the rules, but also realizing to every rule there's an exception. And sometimes it's an 80-20, sometimes it's a 90-10, sometimes it's a 95 split.
Yeah.
But even if it's a 95-5 split, you've got to keep your eye out for that 5%.
Yeah.
Because 1 out of 20 will be there.
Yeah.
And so I made that case to the diploma candidate and said, this would be a really strange fracture, but we have this quote unquote trauma, an immediate onset of pain, swelling in the area, a high degree of pain now, like she couldn't bear any weight whatsoever through her hand, and describing it as a 7 on 10. And then we'll talk about the physical exam pretty soon, but strong pain with movement of the finger. So I said, we don't actually have great evidence against a fracture at this point, other than, well, that would be a freak thing,
Yeah.
So yeah, something sinister was on our mind. I think fracture was the only sinister thing, because of the sudden onset. Right? It'd be so unusual for someone to have, a metastasis or primary tumor in that spot. Because I mean, that's where she bumped, her hip. So no, we weren't thinking of anything else sinister. Really, kind of fracture was the main one.
Okay, yeah, sure. I'll let you kind of segue into the physical exam. Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.